Let's talk about akathisia. My name is Maria. I'm a psychiatric nurse practitioner, and I'm also a nursing professor. This is the assistant. So what is akathisia? Akathisia is the feeling of being restless, like you cannot sit still. It's very uncomfortable. Some signs and symptoms might be pacing, shifting weight from one side to another, being unable to sit still, like constantly moving your legs. It can make it very difficult to sleep. It can make it difficult to function. I've heard people describe it best as like, I feel like I need to crawl out of my skin. You might mistake this as your medication not working because it creates like a ton of anxiety and irritability. So what causes this? This is a side effect that could be caused by antipsychotics. Things like Abilify are notorious for causing akathisia. And usually that happens within about 2 weeks of starting it, but it could happen at any dose increase or at any time. It also is very common with SSRIs, SNRIs. I've seen it a lot with Prozac in particular. Medications like Haldol, other antipsychotics, and there's even like heart medications, cardiac medications, and other medications that could cause this as well. The good thing is there's some treatment. Typically, if you stop the offending agent, it can stop, but there are chronic forms that will continue to go on for 6 months to a year, 2 years, 3 years, and ongoing, which is really horrible considering it's a very uncomfortable side effect. Let's talk about treatment. So vitamin B6 at higher dosages can be beneficial. I'm talking like 600 plus milligrams. Talk to your provider about that. Also propranolol, which is a beta blocker, also a cardiac medication that lowers your heart rate, can help with tremor, it can help with akathisia, it can help with other things. You can't take that medication if you have asthma, just an FYI. And there's a bunch of other options to stop that feeling. If you feel like you have that, please talk to your provider because that's not a side effect you should be tolerating.